requests. We'll show you some of that footage in just a moment. Now please take a second to silence your phones and we'll get started. Now for those highlights.
Castellano is wearing something new.
Dr. Rich Castellano money. Dr. Richard Castellano says laser lipolysis gets his vote.
Dr. Richard Castellano.
We asked Dr. Castellano to come in. To Dr. Rich Castellano. The board-certified facial plastic surgeon is one of the first in the country to use Google Glasses while he's working on patients.
Dr. Rich Castellano says that's one main reason behind this new trend. Less expensive, less invasive, cosmetic face procedure.
So she turned to Dr. Richard Castellano for an ImageLift.
Thanks to Dr. Castellano, and I just feel like $1 million. I know.
Dr. Castellano says he's seen a spike in patients like Elizabeth who feel they are being discriminated against because of their looks.
Ladies and gentlemen, please give a big round of applause for Dr. Rich Castellano.
Thank you so much, Stephanie. Thank you. Please, let's give a big hand to our amazing team that put everything together today. It's not easy to put these events together, but we have a great time. We're so excited that you're here. We have a lot of things in store for you, and we are very grateful for the opportunity to share with you your time and to help you with what your quest is. Everyone who's here has an energy inside of them that brought them here. Whatever a reason that brought you here, whatever that reason is, whatever compelled you to pick the phone up, call us, say, I'm coming, setting a time in your schedule, being here. There's many places you could be today. Beautiful day today in the villages. Whatever brought you here today, we are here to satisfy that. And it's an honor to be here in the villages for years, have thousands of patients come through, and we help them with their appearance. And so it's a simple question. Do appearances matter in today's world? Yes or no?
Yes.
Do people treat us differently based on how young or how old they think we are? People treat us differently based on our behaviors as well, so we'll talk about that. We'll share with you what will look natural. We've seen a little bit too much overdone out there, you know what I'm talking about? That doesn't happen here, right? That's why people come here. Some people say Joan Rivers, right? God rest her soul. If she used to joke that if she sat down and crossed her legs, her mouth would pop open. So it really is an honor to be here. I'm so glad that you get a chance to meet some of my team. We have other team members. They take such great care of me. They will take great care of you as well. I can't do it by myself. I love to be the artist, to do the treatments and take care of you, but my teammate, they really are artists with the logistics and the details to make sure everything is done just right for you. So it doesn't happen in a vacuum. There's a big team, there's a big process, and you'll get a chance to meet us and how we do things. And you've got our book, which is a Wall Street Journal bestseller. Patients read that, say it was very informative. They felt very prepared to make a decision. My goal is that you know what your options are. When you know your options, you can make a choice that's right for you. Everyone is different. Everybody has different goals. We have different anatomy. Some people have done treatments before. Some people have never done a treatment. Wherever you are, before you leave today, you will have a plan for the next 10, 20 years. What are the right treatments to do? There are 4 basic categories that we address, and you should write this down. Number 1, if we sag, we tighten. Very basic, but we keep it simple because it can get confusing and overwhelming. So we'll simplify the whole process. If we're sagging, we're going to tighten. Number 2, if we lose volume, then we fill, we plump. We are just putting things back where they already were. I have 3 kids. My daughter's 14 and my 2 boys are 11 and 10. And every day, what are we telling them? Put that back where it belongs. So if we sag, we tighten. If we lose volume, we fill. If we get sun damage, wrinkles, and sunspots to the skin, we lose collagen in the skin. We put that back in. We build the collagen back up, and we treat the sun damaged skin. The fourth category outshines everything else, and that's our behavior. And none of our treatments look as good as Mother Nature's free facelift. When we smile, it plumps our cheeks. We look our best when we smile. Do me a favor. I want you to turn to who's next to you and just give a big smile. Give a big smile. Don't we look better when we smile? You feel that energy in the room? It's nice. That energy is always there. We just have to access it through our behavior. It doesn't require any words. Every consultation, I ask the patient to smile in the mirror. And that's our model. That's what we know is going to look good, because we're going to recreate that volume in the cheeks, and it tightens us here. We have a little relaxation through here. Some people tell me, they say, well, when I smile, I really don't look that good. It gives me more wrinkles. But those are the best looking wrinkles that we will ever have. I don't make the rules up. We will always look our best when we smile. Now, I can help you look younger, but if you want to look more attractive, it's the smile. And if you want to look even younger than what the cosmetic treatments can achieve, you just have to act immature. It works. Now, the smile is practical. You can actually measure people's smile. Isn't that interesting? 0 to 10, like they do in the gymnast. If they stick the landing, they get a 10, right? Some people have a 10 smile. They smile no matter what happens to them. Well, it looks like I got a flat tire. Some people, no matter what happens to them, they never smile. They don't stick the landing. They get a low score. When you go visit a doctor's office, what do you feel the average smile score is for that doctor? I heard a 3, a 2, a 0. Sometimes it's high. Usually it's low. What smile score would we like for our best customer service and the best patient experience from the doctor? What would you like to see?
10.
A 10. How long did it take you to figure that out? I know what I want. I want a 10. Is it really that hard for these doctors to smile? That's one of my other jobs, is I help teach bedside manner. I help teach doctors how to connect with their patients. You may know a lot, you may be very smart, but if people don't trust you, they don't really care what you know. You must be able to show and communicate. I care. You can trust me. I'm confident. I know what I'm doing. And that comes through the smile. Now, it's helpful in the consultation as well. I'll give you an example. If I do a consultation with someone that I'm meeting for the first time, and I am not able to get them to smile through the entire consultation, what do you think the likelihood is they're going to smile after we do our very best work?
They're not.
They're not going to. So I need to have a conversation with them and say, you know, I'm not sure that this treatment is going to give you enough improvement to make you happy. I just want you to be happy. Really? When I do the consult and I ask people to smile in the mirror, this is how some people smile. They look in the mirror and they go like this. Like they're really trying to get it out, and it doesn't come so easily to them. And then I discovered that some people just have a debilitated smile. They never do it. And when they want to, it's not as easy to do. So we have a lot of great smilers on our team, and we love, I can see there's a lot of great smilers here. So to show you the power of smile and how this impacts how we create a plan for you, if we really want to look our best, none of my treatments come close to Mother Nature's free facelift. But we're going to do a little exercise. I'm going to have everyone here stand up, and you'll need a partner. So when you find your partner, my team will come from the back, or Dana can help out, and Stephanie. Find a partner. One partner has their hand up in the air. The other partner hands down. Now, if your hand is up, you are the smiler. If your hands are down, you are the poker face. Smilers, your job, and we need one partner over here.
I don't have a partner.
She'll get her partner here. She'll get you one in the back.
Bring it on up here.
You are the smiler. Your job is to
Bring it
get
on
them
up here.
to smile. Poker face, your job is to do not smile.
All right, what's the
See
deal
if you
with
get to the
this?
smile on 3. Ready? 1, 2, 3, go. If you get to the smile,
All right, not bad. Not bad. All right, hand it to me.
all right, give yourself that hand. Switch it up.
All right,
You in the
bend me.
poker face. Now you're the smiler. Switch it up. You're not done yet. Come on, you're the smiler. You're the poker face.
Yeah, you
You
make
get
me
to the
smile.
smile. Ready? On 3, 1, 2, 3, go.
Yes! You're looking good now. You're looking good like a shot. Yes!
Give yourself a hand. Give yourself a hand. Now, what just happened there? Were you able to get them to smile? Were they trying not to smile? Even people that go through the whole exercise and don't smile, usually at the end they say, well, could get me to smile. Put a little smile. Now, we can influence other people with our behavior. And who's the most important person we're going to influence with our behavior?
Us.
And when you really don't feel like smiling, you put a smile on your face and you say, I really don't feel like smiling right now. It makes you smile, right? So this is important for helping people make the right choice in how to improve our appearance. Do you follow me on this?
Yeah.
Behavior is by far the most important, and I will work on the anti-aging and show you what you can do that you will look natural. So 4 categories: tightening, volume, skin, and then behavior. Now there are 4 principles that you must follow for your best results. Number 1, you must look natural. You gotta say that back to me. We're gonna say it together on 3. Ready? 1, 2, 3. You must look natural. Number 2, safety. That's number 1. Safety. Number 3, prevention. If we're lucky, aging keeps coming. Prevent future aging changes. Number 4, give you as much improvement as possible. Those are our 4 principles. So when we do the one-on-one, I always start out by saying, where is your focus? It's different for everyone. Some people say a specific area, some say full face. Wherever your focus is, that the little details don't tend to bother them so much. So this was Judy. She was humble, she was very quiet. We had a nice conversation. She told me about her parents, she told me about her family, and she told me about her goals. So we sat down in front of the mirror, and I pulled back like this, and I said, how does that look? She says, I like that. And I said, some get a little bit less, some get a little bit more. If we need to come back another day, that's better than going too far. So at that point, she turned around, and she looked at her daughter, that was there with her, giving her the look, like, well, what do you think? And her daughter looked back at her and said, you go for it, Mom. It's your time now. So Judy did a laser image lift. She did an eyelid treatment and some fillers in the cheek, and here are her results.
Oh, wow.
Thank you. It is a big difference. It looks natural. It's not overdone. And notice the top of the cheek, that's filler. We didn't do surgery in the top of the cheek. We trimmed a little eyelid skin, and the tuck is an office-based procedure, the image lift, and it looks natural.
How about the eyelids? Did you do the upper and
We
lower?
did the upper eyelids, and we did some fillers in through there.
Huh.
So you can, for the lower eyelids, you can either fill, you can tighten, or a combination, and we'll go through that. So Judy comes back for her follow-ups, and I love seeing patients in the follow-ups, because when I ask them, I say, well, what's the response been? And people come back, the most common thing people say is, no one can figure it out. They think I changed my hairstyle, I lost some weight, and patients love that. Some patients come back and they're frustrated. They said, no one can figure it out.
That's a compliment.
It's a compliment. So Judy was telling me, and she's standing a little taller, shoulders back, she's smiling more, she's more animated as she's talking. She was telling me that she was driving with her son. and they got a flat tire. Her son pulled over to the side of the road, and another couple stopped to help them. And as they did, they were talking with her son, and they asked her son, "How is your wife doing in the car?" And she loves being mistaken for her son's wife. So she's telling me this, and she said also she had been attending her church. She became a greeter for the very first time at her church. "How are you? Good to see you. Why don't you come on in? Let me get that door for you." And she was opening up. And it's always wonderful and beautiful to see people blossom. It is never too late to do the right thing. And so we love seeing our follow-ups and love seeing people really get in touch with who they feel they are. And that's why we love doing events like this, because we know we can help you just as we help Judy. We don't make things perfect. Some people say, well, can I make this gone or take this away 100%? I never use the words gone, take away, or get rid of. You want to make things better so that it looks natural. Perfection in plastic surgery is dangerous. There's a risk. It's okay to have a very high standard, but if you have such a high standard that it goes beyond what the treatment can deliver, you may be tempted to choose something that goes too far. Now that's my job, to protect you from that. So perfectionism, and sometimes we can be a little hard on ourselves. You know what I'm talking about, right? We look in the mirror. Did you ever realize how we never really see ourselves the way that other people see us, right? There's a physical reason for that. When we look at other people, if you watch people, if you people watch, you notice when we look at other people, we give a little facial expression to other people. But if you watch someone looking in the mirror, you realize we go flat like a cadaver, flat like this. And sometimes we think that's how other people see us. You look at someone else, oh, hi, how are you? Okay, flat. If you look at someone flat like this, it's rude. They think you're mad at them. So when we look flat in the mirror, just don't let yourself think that that's how other people see us, because it's not. And when you look in the mirror and you smile, we always look our best. So these are the things to keep in mind so that you can make a good decision and you can feel good about what you've got. Because no matter where we are, it could always be better, it could always be worse, right? If we're too hard on ourselves before we do a treatment, you're going to be too hard on yourselves afterwards. You're not going to be happy. You only live once. You've come to the right place. We will help you. We will give you guidance. You can choose what's right for you. You will look natural. Right? Do you follow me on this?
Yeah.
All right. So there's Judy. Now, this is Sally. She's a swimmer. She did a laser treatment to the face. She did an ImageLift procedure. She brings donuts to the office when she comes in, so we love seeing Sally. And difficult to see the incision locations. It looks natural. It's not overdone. Mary came to an event very similar to this, and she'd been wanting to do the lift for 5 years, and she felt stuck. She felt she couldn't get it done because she could not get her finances figured out. She had commitments and obligations, and it was overwhelming. So how is it she was stuck, but she still got the lift done? How did that happen? So Stephanie and Mindy and Janine, you met them coming through. If you're stuck, let us know. We help you get unstuck. You just need one pathway to make it work, and we'll give you many options, but when we figure out the details for you, you can make it happen. You'd be amazed how flexible we can be. So if we can do that for Mary, we can do that for you. Now, this next picture I'm going to share with you is really our best before and after picture that we've ever achieved. We're using the latest technology, the power of smile, and all of my experience with thousands and thousands of patients, all wrapped into one, and here it is. I'm very proud to share this with you. Didn't we do a great job? Let me ask you a question. Do you think that we ever have people that come to us and they want this kind of improvement?
Yes. Yes.
We have to talk with them.
I think they waited too long.
They waited too long. There's a limit. There's a limit on how far we can go. There's a limit. I was at a seminar and I asked that question. One woman stood up in the front row. She says, "Here I am. I'm that person." So we can't take it this far. We'll take you as far as we can. If we need to come back another day, then that's always better than going too far. We can't go this far. That's my daughter, by the way, when she was in 3rd grade. And now she's 14. She wants to drive next year, and she's such a great daughter. But boy, she's a young woman now. So we're very proud of her. This is Melba. Melba lives here in the Villages, very active in her clogging in the past. She called these her Richard Nixon jowls. And she did the lift, she did laser, she did a touch-up procedure, she did filler, we did some upper eyelid treatments. She looks natural, she's not overdone, difficult to see the incision location. Jeannie's a nurse. We have a lot of healthcare providers that come through because they don't want to go to the hospital. They don't want general anesthesia. These are office-based procedures. So it looks natural, and she sent in one of her family members, and in their words, they said they wanted to get rid of their turkey gobbler. So when people come in, their family and friends follow. Martin, he lives here in the Villages, and see how he's got this draping of skin along his chin and jawline? He didn't like that, it didn't make him feel good. So he tightened things up. Looks natural. Now you see this little sunspot he's got here? Can you see that over here?
No, how'd you get rid of that?
It's pulled up all the way right behind his ear there. See that? All that skin goes back. Okay? So, and there he is smiling. We always look our best when we smile. Always, always, always. Mary had a lift procedure done. Now, she started out with a lot. We did a procedure for her and she was not satisfied. So we did some additional tightening for her, and that's where you see her result here. If we need to come back another day and do more, that's always better than going too far. You follow me on this?
Yeah, I agree.
So now her story is her grandson was 5 years old at the time, and we would greet her, he would run and jump into her lap, give her a big hug, and he would take his little hand and reach up to her neck and pull it back and forth like this.
Gobble, gobble.
Oh, she hated that. Now he doesn't have anything to grab onto anymore. Now I show Al's pictures because there's 3 types of lifting procedures that we'll do. The ImageLift is the most that I will do. It's not a traditional facelift. There's no general anesthesia, no IV sedation, no cut across through here. Old-fashioned facelifts used to make the hair bald in this area. That's not necessary. So you don't want to get an old-fashioned facelift today. You got to make sure you're checking these things. So the ImageLift is the most I will do. Local anesthesia, you take a little relaxing medicine by mouth, numbing medicine like at the dentist, lift the skin, tighten the muscle, trim away the extra skin.
Amazing.
That's the ImageLift. Takes me a couple of hours, 2.5 hours. We never hurry. We take whatever time it needs to get the job done. Then there's a step below that. I call it the mid-lift. Now what is the mid-lift? The mid-lift is for someone that still wants to tighten their profile, but they psychologically just want a little bit less, or it's easier for their budget. So the ImageLift, then the mid, and then there's the mini. Now the mini is a great procedure. A lot of doctors won't do the mini. They think doesn't get good results. I've got a lot of happy patients that have done the mini, but it's got to be the right person. If you say, this spot right here, it doesn't bother me, but I like this, then the mini is a great option. But if you do a lift, and afterwards, if you do the lift and say, if I've got something here afterwards, I'm not going to be happy with that, then I won't recommend the mini. Do you follow me on this?
Yeah.
So we lay it out so that it's easier for you to make a decision. With all of our lifts, if you need to come back another day, that's better than going too far. So for Al, I said, he's got a lot here. My recommendation was, let's do the ImageLift or the mid. Al said, just do the mini. I'll be fine with that. Just do the best you can. Whatever you choose, I will go for the gold. I'll go for the best result that I can. I did the mini for him. He got a nice improvement, but notice he still has this here under his neck. He's okay with that. But some of my patients, they would not be satisfied. So that's why the one-on-one is so important. During the one-on-one, we'll tell you, here's what I recommend. We'll talk about it together. I'll talk about the risk. Do you need a touch-up or what other treatments you may choose? Before you leave today, you'll have that plan. It's a different plan for everyone, and that plan worked out just fine for Al. Now this is no surgery. This is a laser procedure. We put a laser fiber under the chin, there's no cutting away of tissues, no stitches. Okay? This is 1 day later, she's a little swollen, but notice here how there's less tissue under the neck. So that's 1 day later, laser tightening. We lose the elasticity in our skin. It's like the elastic band of the old sock that gets stretched out. It doesn't fit so well anymore. So the laser tightening is a great treatment to do for someone that says, I'm not ready for stitches yet. It's an intermediary treatment. You get many years of result. With the laser tightening, people may wait 3 to 5 years before they do something else. It just depends on what they do. If you're not satisfied with what laser tightening would do, the lift is the next step. People ask longevity for the ImageLift. Longevity for lifting procedures, it's like, it depends on how we take care of ourselves. It's like getting 5 years or 50,000 miles out of our tires. Some people, usually they'll wait 5 to 15 years after a lift before they say, maybe I'll do more. We can't stop the aging process. If we're lucky, aging keeps coming. Some people come back after a year or two for a tuck-up. Some wait 20 years. So if we take good care of ourselves, and we have measures in place to help you with that. Dana does our skincare. You can talk with her and come up with a plan for your skincare. Sunscreen, sun protection, stable weight. We go through all of these things to help you get the most out of your lifting procedure. So laser tightening works. This is 8 months later. Fillers in the corners of the mouth and fillers in the cheeks. Monica came on TV with us and demonstrated her results. It looks natural. So the laser tightening does work, but that tightens the skin only. Now the ImageLift tightens the muscle. This is 1 year after an ImageLift, tightening of the muscle, and it removes the extra skin. Okay? Now, we combined those for Judy. Judy did laser for the skin, lift for the muscle, lift to remove the extra skin. Deb has a radio show. She's a fitness instructor. Laser for the skin, lift for the muscle, lift to remove the extra skin. RJ, she's an actress. She's in movies and in television. So her appearance is important. We have a lot of media personalities that come through. Laser for the skin, lift for the muscle, lift to remove the extra skin. Now some of you have your photos in your 20s or 30s. If you don't have them, it's not mandatory, but you can see. Here's where we started. Look at the volume. Oh, there we go. Careful on that table, it's going to move our slides. And he's taking notes here. There's an earthquake. Say, hey, what's going on? So, no problem. So when we're young, we're full of volume, and then we lose volume. See how we hollow right in through here and see the jowl coming down, a little sharp triangle. So we've tightened and almost removed the jowl. Fill, combination of filling and tightening will give you your best results. Full of volume, so our younger pictures are very powerful. Now some people will ask, well, which should I do, the fillers or the tightening? Well, the real question is, how good of a result do you want? If you want your best result, people tend to start with the tightening. If you want a no downtime option, the fillers do great. They don't replace what the lift will do. And your best overall result is you combine them because they don't replace one another. We are just systematically putting things back where they already were. Now look at her jawline here, how full it is. But do you see how the jawline just tends to fade away right there? Jowl, we did some fillers and built the jaw and tightened up the jawline. It looks natural. Katie's a figure skater. She was a nurse. She was taking great care of her body. She didn't feel that her face would respond to her treatments anymore. She could build up her body, so that's why she came to me. Liz is 18 here. She's 72 here. And see the hollow? We lose that volume. Now, why do we lose the volume? We lose bone as we get older. We get a little bit shorter as we age, okay? The bony prominences in the face. Take your finger and feel your cheek right here. You feel the cheekbone, that's a prominence. Put your finger on your brow, then the back of the jaw, feel the back of your jaw, and the chin. Those 4 prominences, they erode. There's like mountains that just slowly get a little smaller, and as those prominences erode, our facial mask will sag a little bit over top. Try not to be a downer, but that's just the way things are. But if we at least understand that and recognize it, then you can treat it. You are going to get options here that you will not get in other places, right? And that's how we come up with that. Volume, and it looks natural, it looks good. Fillers, do a great job. There's no downtime. This woman came in, she did her fillers, she loved them. She came back 6 months later and she said, well, I really like my fillers, but they're all gone. So I showed her her pictures, and when she looked at the pictures, she says, oh, I the lines were that deep before. There's a famous plastic surgery saying that after we do a cosmetic treatment, our vision gets better and our memory gets worse. When you do a cosmetic treatment, you will look at your face more than you have ever looked at your face. You're going to notice one brow's a little different, the different pores. You'll see wrinkles. We have more wrinkles on one side or the other. Usually it's the left side, because when we're driving, we get more sun through the window. Your vision gets better afterwards, and the memory gets worse, because we don't remember what we used to look like. It's like our old hairstyle 2 or 3 weeks ago. We don't remember what that looks like. I have a new hairstyle now. The vision gets better, the memory gets worse, but we'll show you the before and afters so you can see. Some of my patients, they'll tell me, oh, don't pull up those before. I don't want to see those before pictures. She's like, I can't believe, whew, I'm so glad I am where I am. So, but we keep those on file so you can see the comparison. Now this is full face volume. Laura, as a busy practice manager, I did 7 syringes of the Bellafill. It looks natural. She's not overdone. We also took the mole off of her cheek. So that's full face volume. Some people are happy with just 1 session. Some are not satisfied until they do a second session, right? This is 16 syringes of the Bellafill. No downtime, 30 days, less than 30 days. It looks natural. We've won awards for our results. Laser treatment. If the lipstick bleeds into the lipstick lines around the mouth, you can do a laser. It's a burn to the skin, and it polishes and builds the collagen. You need 7 to 10 days. You don't want to see people. Aunt Shirley did the lift and the laser combined. She came on TV to demonstrate her results, and after we did the segment, she looked at the monitor at her pictures, and she said, you know, I just don't remember having all those wrinkles. The vision gets better, the memory gets worse. And Aunt Shirley's grandson just got married recently, so she looked great for the wedding. She's in her 80s now, and her daughter came in and did the lift as well to look their best for the wedding pictures. Phyllis called these her waffles. She said it looked like she fell asleep on a waffle iron, right? And she did the lift and the laser combined. So let me ask you a question. Have you seen some results that you've liked so far?
Sure.
Would you be happy if you had results similar to what you've seen? You've come to the right place. One thing that I've noticed, really, what is it we're doing here? This is about quality of life. If we've made it this far, and by the way, congratulations to us, we've made it to today. We made it here, right? Quality of life. What's a great example of quality of life? Living in the villages. How many of you are from up north? Do we have to ask why you moved down south?
Heat. I love the heat.
Love the heat, there you go. No snow, no snow shoveling. When we live up north, we move down south, and our quality of life, it goes up. Now, when our faces start to go down south, you lift it right back up north, and the quality of life goes up. But this is also about patterns we get into. You ever notice how people get into patterns, or we go on autopilot? For example, when we're driving. You ever have the experience, you're driving your car, you get into your driveway, and as you're parking the car, you can't remember the past 5 or 10 minutes you've been driving? That ever happened to you? Because you were in a pattern, you were on autopilot. Or you put your clothes in the car, and you're going to drop it at the cleaners on the way. And what do we do as we're driving?
Past the cleaners.
Go right past it, because we're in a pattern when we're on autopilot. So when we look into a mirror, we all have a pattern. We tend to look at the exact same places we always look at. We go on autopilot. We tend to say the same things that we always do. When did I start looking like my mother, father, brother? And it makes us feel the same way on autopilot. Some of my patients tell me that they don't like the way the mirror makes them feel. They don't look. They get their hair ready, but they don't look, they don't spend time because of that pattern. So I want to ask you, this is Dale. What do you think her pattern was when she looked into the mirror? She's in her 70s. What did she focus on, knowing she had lost her youthful appearance? And what did she say to herself, and how did it make her feel? Dale came into our office. She did a laser image lift. She did fillers and eyelid treatment and a tuck-up procedure. Do you think she has a different pattern now?
Yes.
What does she say to herself now?
Better.
What does she focus on? She does look better. And how does it make her feel?
Better.
Her pattern was never the same. She never looked at herself the same way again. Dale came out to many of our events and she inspired people to do treatments. And she's such a great smiler. I'm sad to say that Dale's no longer with us. She was diagnosed with a condition. She passed very quickly. But she is a reminder to us all that tomorrow is not promised. And we live for today and we smile for today. So we were able to do this for Dale. Dale's a great example of what we can do for you, and we're very grateful to Dale for inspiring us to do our best in what we do. Now, everything in life evolves. If you told people 30 years ago what these devices could do today, what would they have said?
You're crazy.
But not only is what was crazy real, in a year or two these are going to be old. What else has evolved? Have grandparents evolved?
Yeah.
What were grandparents like 30, 40 years ago? Grandparents today, they're hip, they're athletic, they're living longer, they're working, they're raising their grandkids in many instances. Plastic surgery has also evolved. The results are better, it's safer, it's more affordable. There has never been a better time to do a cosmetic treatment. That's why we're here, that's why we're so excited to share what we can do for you. Sherry, she did an ImageLift procedure. She recently did a little tuck up, right? She's doing just fine. She's an image consultant. She did not tell her family she had it done, and they couldn't figure it out. Bev is here today. She did laser treatment. She did a touch-up procedure. She did a little bit of laser. Between these two pictures, she did laser tightening for the neck and laser treatment for the face.
Are you saying that there's no anesthesia?
Local anesthesia, but there's no general anesthesia. So you take relaxing medicine by mouth, like a lot of people take before they go to bed. Numbing medicine like the dentist office, right? So no general anesthesia. Jen sets up a lot of our events. She's been with us almost 8 years now. She did a lifting procedure and she looks natural. Linda comes out to a lot of our events. Look how full she is when she's younger. Full of volume, then we lose volume here. We did the lift and the fill. It looks natural, it's not overdone. I saw Nancy today. She's very pleased. We were looking at some of her before and after pictures. Wow, what a difference. Because she's done some fillers since then, and she wanted to do just a little bit maintenance treatments, but it looks natural. That's just a mini lift and some fillers. So, for many of you, that you see pictures that you like, we're in the right ballpark. There was an energy that brought you here. Some of you are ready to say, okay, here's what I want to do. Let me set my date and I'm going to do my treatment. Some of you may be saying, I really like all this, but if there's something that's holding you back, these are the common things we'll talk about. If you see something here that's holding you back, just let us know. You'd be amazed how flexible we can be. If it's the finances, just like we did for Mary, we can figure it out for you. Put something together that works. You don't need the same plan as other people. You just need the plan that's right for you. So if the finances stand in the way, let us know. You'll be amazed how flexible we can be. Your schedule may be very busy. You've got mahjong, pickleball, clubs, you're on a cruise, you've got golf, families coming to visit. If you've got a busy schedule, we have no downtime treatment options. If you have time in your schedule, we can factor that in, but we will figure out something that works for your schedule. Maybe you're allergic to fear. We take the fear out of it. My niece was 3 years old. When I got the phone call, she fell and split her forehead. So we brought her in, we numbed her up, we put the stitches in. She did not shed one tear. And I promise you, if we can make her feel comfortable, we'll make you feel comfortable too. You can have a lollipop too. We take the fear out of it. When patients watch me do the videos, I broadcast a lot of my procedures live. Hundreds of thousands of people have watched all over the world, no filters, no editing, live. And patients appreciate that. They often tell me, I really liked it how you made them feel so comfortable, right? That's what we do best. We take the fear out of it. Some people say, well, I'd love to do it, but just be so selfish. I'm helping out with my family. How many people here have raised a family? Who gets put first in family? The children. Who gets put last in family? That's what we love about what we're doing here, is we get to put you first. It is your time, and we're not going to stop giving to our families. We love them. But if we feel like we're dragging on empty, how much can we really give? But if you give to yourself, do something that excites you, and you feel great about yourself, believe me, there's more to give, and you will give more, and it's always a wonderful thing. So being selfish is being smart. What are your family and friends going to say if you do a treatment for yourself? Are they going to talk about you? Who cares? They are going to talk about you no matter what you do. You might as well do a treatment. Right? So those are the common things people tell us that holds them back. This is what we talk about in a consultation. What are your areas of focus? It's different for everyone. What is in your heart? If you get confused or overwhelmed, just ask yourself, what is really in my heart? What do I really want? It clarifies the situation very quickly. We always know what we want. What else have you tried and did it work? Almost every day, I will see a patient that says, I did this treatment at another location and I'm not happy, can you fix it? What else have you tried? It's always best to do things the right way the first time around. We need to know, what have you done, what worked, what didn't work, and we factor that into your recommendation. Do you have downtime available? If you got downtime, great. We accommodate for that. If you don't have downtime, we have no downtime treatment options. That's what we talk about in the consultation. Safety first. Now, the ImageLift is an office-based procedure. There's risks involved. We minimize that as much as possible. Bleeding or fluid collection, we take care of that in the office. Infection, we put you on an antibiotic. Damage to surrounding structures, risk of a weak lip or eyelid is uncommon. It's rare that would be permanent. It's less of a risk than a traditional facelift because we stay more superficial in an attempt to avoid that. Sometimes a deep stitch we put in can come out of the skin like a splinter. If that happens, that's easy for us to take care of. Everybody's face has asymmetry. My right eyebrow sits higher than my left. I tell everyone, you're still going to have asymmetry afterwards. That's what makes us look natural. When you do a lift, your ears can be numb afterwards. When the nerves grow back, you might feel itching, tingling, soreness, or pain. Most will say it's numb. I don't really notice it. It's getting better, and it goes away. And the healing process is unpredictable. Most people heal just fine. There are some people that choose to do a touch-up or an additional treatment may generate an additional expense. That's more the case. People come in, they've got a big neck, we do a nice procedure and clean things up, they get a little relaxation. They want a touch-up. It can cost more money. Then I tell you, risk for that is low, medium, high. We'll talk about that in the one-on-one. So you have an idea of what is right for you. Do you follow me on this? Now, everything that we do is under local anesthesia. Safer this way. So the risk that someone has to go to a hospital or have a heart attack or stroke is rare. So that's why we do it this way. Safety first. Now, with facial fillers, when you do the facial fillers, the risks of facial fillers are undercorrecting. If you undercorrect, you can always come back and put more in. Risk of overcorrection, I'm not going to overcorrect you. If you do overcorrect, you can fill the areas around to even things out, but that's why the most important decision you make is who is taking care of you. Risk of lump or bump formation is uncommon. If it happens, it's treatable. Most people feel the fillers, and they say, I know the filler's there, but I don't feel anything. Some say, well, I do feel something, but I don't see it and it doesn't bother me. I leave it alone. Rarely do I make an incision to take a nodule out. My strategy, use a small amount over a large area to minimize or eliminate your risk for that. Now I use safety cannulas for most of my injections. What is a cannula? It's basically a soft needle. Less bruising, less trauma. Risk of getting the filler into a blood vessel causing scarring, loss of vision, damage to surrounding structures is rare. That's why you want an expert injector. So safety first. I give my cell phone to all my patients. My friends think I'm crazy for doing that. We get very few phone calls. Patients find it comforting that they can reach us at any time. So safety first. We like to reward people who take action. And if you put a deposit towards a lifting procedure, we give you, Mindy, what are we doing? We're doing $1,000 off a lifting procedure during a seminar if you place a deposit, and that locks in your pricing and it locks in your date because the schedule gets booked out. Snowbirds, we have people coming from out of town as well to do their treatment. So the deposit will lock it in for you, and you get $1,000 off a deposit for a lifting procedure. We love getting referrals. I saw another referral today. Almost every day we get a referral. And I have discovered that you should never tell your family or friends that they need to see a facial plastic surgeon. It just doesn't go over well. So instead, we let you off the hook. Just tell your family or friends if you think, because once you're here, you'll go and meet your family and friends and say, boy, they really could use this. We hear it all the time. So you can just tell them that you met this really nice office. We have an esthetician, Dana, and she'll do a facial mask for them to get to know them totally for free. So send them in. They just have to call, make the appointment, and then when they come in, and Dana will take great care of them as she always does, then we'll have the talk. But that lets you off the hook. Don't tell them they got to see a facial plastic surgeon because they'll remember that. So I'm going to ask, now's the time we're going to answer a few questions. When we're done, they're going to bring in some food. We'll do the one-on-ones, and even though there are a lot of people here, it doesn't take that long. I'll have time to go through and meet with each of you. And if you need more of my time after today, we just set that up in the office. You can have all the time that you need. And then we're going to do a raffle drawing for a free filler treatment in just a few moments. And when we have 3 more consults left to see, we do one more raffle drawing for a red carpet VIP peel done by Dana. It's a $500 value. And you'll love that treatment. So what questions can I answer about what we've talked about?
Where's your
so far?
office in the procedures that are done?
We do procedures here in the Villages and in Tampa.
Okay.
We're off on 440, Highway 440, right near Santa Fe Business Center, just east of Morse Boulevard. Thank you very much. Yes, go ahead.
No, I didn't have my name.
Okay, yes, go
How
ahead.
long do the fillers last?
We have temporary fillers, we have long-term fillers that are not absorbed. They stay with you. Most doctors agree that they're permanent. The body does not have a way to absorb them. The Bellafill is 80% collagen and 20% PMMA. The collagen gets absorbed and replaced by our body's own collagen. The PMMA is permanent. It is not absorbed by the body. Thank you very much. Yes, go ahead.
I noticed on your before and after pictures, you had no black faces. Now, how does this react with black skin?
Yes, so a lot of our patients, when you have less pigment in your skin, you have more sun damage to your skin. So on our website and some of our before and afters, and we've got some I'm happy to show you, we do have patients have more pigmentation, African American skin. Some of my best before and afters, I ask patients, hey, can we use your pictures? They say, oh, I'd like to keep them private, please. So we always respect that. So we're happy to show you those individual pictures. We just do a medley of them. We also have Hispanic patients that come through, and they do just fine. You may not do certain laser treatments, okay? And so I've got some on my computer. We have some on our website as well, so you can see that. And it depends on what they're doing. Filler patients, laser patients, laser resurfacing, you don't do that as much when there's a lot more pigment in the skin. Thank you very much. Yes?
You're not using Juvederm.
Yes, I can use Juvederm. Juvederm is hyaluronic acid, so it's like Coke and Pepsi. There's Restylane, Juvederm, Voluma, Bellatero. They're all hyaluronic acid, so there's basically a similar structure. There's a little bit of difference in the formulation, but their longevity is similar. So I can use any filler that's out there on the market, but more commonly, people want a longer term filler.
And does the longer term cost more?
The most expensive filler is the temporary filler. You have to keep replacing it. So some patients will spend $1,000 to $4,000 every year on the temporary fillers. Once you do fillers long enough, everybody starts to say the same thing. Don't you have something that lasts longer? So have access to all of the fillers. Whatever filler you choose, we're happy to treat you with. Temporary, middle of the road filler, or long-term permanent, we've got access to all of them. Thank you very much. So what we're going to do now, so Bev and Linda and Mel, why don't you ladies come up. Let's give our models a big hand for coming up today. Thank you, ladies. They're like a part of our family. We appreciate you guys coming out. Mel a big hug. Thank you for coming out. Everybody looks so nice. So Mel, can you share with us, what was it that inspired you to have a cosmetic treatment done?
I started looking really old when in my 50s. My face was, I don't know, I had crepey skin and it just started hanging off my face. So Dr. Castellano was the 7th plastic surgeon that I chatted with, and he was the only one that I would let do anything to me. He gave me back me. I wanted to hide. No amount of clothing in the world would make me feel good enough to go out to dinner and feel good. I looked at people and thought, oh my God, you look so much better than I ever looked. You know, comparing myself to other 60-some-odd-year-old people. At 64, I had all the junk clipped off by Dr. Castellano. And I can't tell you how happy it made me. I mean, there's no comparison to before and after.
How long did you pretty much remain in your home before you were?
Just a few days. I went to the grocery store a few days after, and to the gym, because he knew I couldn't stand to not go to the gym. I go to the gym for pain management, so not going was a biggie with me. I had a Band-Aid here and went off to the grocery store. I'll show you the pictures.
Oh, wow.
'Cause I did a kind of
How many years ago did this occur? Did he do?
a couple of years.
You look lovely.
Thank you. Thank you. I feel lovely.
So we talk about physical versus social downtime. Physically, people get back into their routines in a day or two, errands, shopping, things around the house. Socially, you pass the grocery store test at around 7 to 10 days, but some are more quick and some may take a little bit longer. But that's a general rule of thumb, but you ease into your activities, but it depends on what type of treatment you do. We go through that in a one-on-one. So thank you very much. Let's give Mel a big hand. Thank you, Mel. And so both Linda and Mel came. They were recently, we did a little TV segment, and they both came out with us. So Linda, can you share with us, what was it that inspired you to have a cosmetic treatment?
Mel inspired me because I work at the gym where she lives, and she came in and she looked so fabulous. I said, well, I want to go to one of your seminars. So I went, and I had laser resurfacing because I had a lot of sun damage, and then I had the Bellafill, the permanent filler. Because, you know, I work out, I eat right, and I wanted my face to match what else I was doing. And I loved every minute of it. I get so many compliments. I let my hair grow, so people thought, well, you got your hair long. You didn't do any cosmetic surgery. So that's my story.
Thank you for sharing that. Let's get Bev out. Here's Bev. Bev come out to a lot of our events as well. And Bev and Sherry, there are some people that they don't have any family or friends in the area, and they need someone that can drive them or stay with them for a day or two. Bev and Sherry do that. So, Bev, what was it that inspired you to have a cosmetic treatment?
I came to a seminar because I had nothing to do that day. That was what, 7-8 years ago. And then they gave the pricing, and I went home and I told my husband what the pricing was, and he goes, well, that's not bad if you want to do it. I couldn't get in that golf cart fast enough. I was up here. I have been a regular ever since.
So, we're going to do, it means so much that our patients can come out and they share their stories. Everyone's experience is different. So when you talk to enough people, see enough pictures, read the book, go watch our videos online, we're completely transparent. I don't know any other facial plastic surgeon that broadcasts their procedures live, no anesthesia, no general anesthesia on an awake patient, and they feel comfortable. So we're going to do the raffle drawing. This is for, what are we raffling off today? One syringe of the Radius. And so everyone who came in, if you walked in and you were entered, so our lucky winner for our raffle drawing today, this one feels very lucky right here. It says Marie Mioni. Marie, where's Marie? There's Marie. Congratulations. Marie, all you have to do is call the office and set an appointment. And you win one free syringe of the Radius. It's a facial filler that plumps, it's calcium based, and you'll love it. Congratulations. So what we're going to do now is we can go ahead and start seating the consultation. We'll need to find Elise, and you can start setting that down. We'll start doing the consultation, so they're going to bring the food in. Just sit tight. I promise it won't take that long. We'll get through all of you. And we have one more raffle. At the when we got 3 more people to see, we'll do one more raffle drawing. So so it won't take that long. Thank you so much for your time and your attention, and I look forward to talking to you soon. Thank you so much.
My friends